Patients that suffer from fibroids often have heavy menstrual periods where they're often passing clots. These patients also have anemia, which cause other symptoms. Patients can also suffer from bulk symptoms, which include anything from back or leg pain, urinary frequency, constipation, and also pain during intercourse. Fibroids become more common in women that are 30 to 40. In addition, African American women have a higher incidence of fibroids. The options patients are most likely to be presented prior to finding out about the uterine fibroid embolization is a total hysterectomy or a myomectomy, which essentially is a partial hysterectomy. The uterine fibroid embolization is a minimally invasive technique where we access the artery either from the radial artery in the wrist or the femoral artery in the groin. And from there, using a series of catheters and wires, we find the uterine artery, which there's one on the left and the right side of the uterus, that supply all the fibroids. Once we find the uterine artery, we emit small beads, which block or clog off the artery. Once the embolization takes place and the beads are put into the uterine artery, the blood flow to the fibroid stops, and from there the fibroids start to involute or start dying. The fibroids can pass externally or are partially resorbed by the body. Once the uterine fibroid embolization is complete, we observe the patient for 2 to 3 hours, and afterwards the patient is able to go home the same day. They do not stay in the hospital. I always recommend taking about 7 to 10 days off work to recover fully. On average, most patients express a relief of symptoms within about a month to 3 months.